Good day, everyone. I am Luigi Estrada from MSU BSN1, and today I am going to perform assessing the nose and sinuses. So, the nose and sinus evaluation will present a brief overview of the patient's nose and sinuses and whether or not the patient requires medical intervention. So, the nose is made up of two parts, the outer nose and the nasal cavity. So it is also the major organ of smelling and helps with breathing. So sinuses are necessary to secure the nose from toxins and pathogens in the atmosphere. So any nasal and sinus problems will have an impact on the respiratory system. So this is to do a detailed examination of the nose and sinuses to be capable of determining the present state of the patient's nose and sinuses, and lastly, to look for any problems with the patient's nose and sinuses. So prior to the conduct of the procedure, I am going to close the door to secure patient's privacy. I am going to need to provide an adequate lighting and adjust room temperature for patient's comfort. Then, gather the necessary equipment, the nasal speculum. I have here the nasal speculum, the alcohol, the pen light, tissue, and lastly, the pen and documentation record. Then, identify the patient and explain the procedure. This improves the client's comprehension of the help and responsiveness to treatments. Then, do hand washing or apply alcohol. Hand washing or hand hygiene prevents the spread of infection. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am about to do. Okay, good morning, sir. I am Lo J. Strada, your student nurse for today. May I see your wristband, please? Okay. Please state your complete name
Patrick Estrada,
and your birthday, please.
June 10, 2010.
Okay, thank you. Please relax, sir. So today, I am going to assess your nose and sinuses. Is it okay with you?
Yes.
Okay, thank you. First, inspect the external nose. Note the size, shape, color, and flaring or discharges from the nares. So there might be indications of sinus infections, allergies, and other signs of disorders. Okay, sir, I am going to assess your nose now. Okay, the size and shape is normal, and the color is the same as your facial color, and there is no lesions from the skin, and also there is no discharges. Okay, sir. Then, likely nasal tenderness on palpation may indicate a local infection. Okay, sir, I am going now to palpate your nose. Okay, it's normal. It's not so tender. Okay, that's good. Then, instruct the client to close his mouth, occlude one nares, and breathe through the opposite nares. So difficulty inhaling and sniffing through a non-occluded nostril may suggest edema or a foreign item blocking the nose. Okay, sir, kindly occlude your right nares and breathe through your left nares, and please don't open your mouth. Okay, just relax, sir. Then, repeat the procedure with the other nares. So this is for better accuracy of the assessment. Okay, sir, are you feeling better when breathing through the opposite nares?
Yes.
Okay, let's see the other side. Okay. How about now, sir? Are you feeling okay?
Yes.
Are you still breathing in a normal way?
Yes.
Okay, so it's the same as the other one. Then, use a nasal speculum and a pen light to inspect the nasal cavities. So this is to detect nasal vestibule inflammation impacting the nasal mucosa, nasal septum, perforation, and asymmetry. Okay, now sir, I am going now to inspect your nose. Okay, sir, your nose wheels are fine. And the hair, it's clean. There's no stimulations. And there is no dirt. It's clean. Okay. Then, hold the speculum in your right hand to inspect the left nostril and hold it in your left hand to inspect the right nostril. This is to observe and inspect clearly the nostrils. Then, ask the client to tip the head back. Place your index finger against the client's nose and gently insert the nasal speculum about 1 centimeter into the nares, open as much as possible. So pressure on the delicate nasal septum must be avoided. With the pen light, shine a light into the nares. So this is to observe and see clearly the nares. Okay, sir, I am going to check again your nares. Okay, sir, there's no dirt. Then, inspect the nasal septum for position, deviation, and intactness. So, the nasal septum may be deviated or shifted to one side. Okay, sir, I'm going to inspect your nasal septum. Okay, sir, it's not deviated, meaning it's normal. Then, gently remove the nasal speculum, wipe it dry with a tissue paper or gauze. This is to remove any possible tissue fluid or solid contamination. Okay. Then, repeat on the other nares. This is for better accuracy of the assessment. Okay, sir, I am going to check the other nares. Okay. It's the same as the other one. It's clean. Direct and consensual reaction. Palpate the maxillary and frontal sinuses. There might be signs of infections or allergies. For frontal sinuses, shine a pen light against the inner aspect of the supraorbital ridge of the frontal bone. So this can help identify certain conditions such as acute sinusitis. Okay. And then we have to check the frontal sinus. Okay. So now I'm going to do maxillary. So for maxillary cyanosis, instruct the client to open his mouth and shine the pen light to the left and the right. So a bright light transmission indicates a typical air-filled sinus. A lack of light transmission indicates the presence of fluid. Okay, sir, can you open your mouth? Okay, it's normal. It's good. Okay. So now, I am going to document the findings. Okay, sir, thank you for your cooperation.